The pandemic has had a substantial impact on many people's mental health, but as we head into the colder months, many are concerned about how that might affect us too. With Ontario now in a second wave, many fear that rising COVID cases coupled with shorter days, colder weather, and more restrictions may be a bigger burden on us mentally. Is this a real thing, or are we just imagining something worse than what it is?
It's just unclear, to be perfectly honest. I mean, I think that the sort of interesting aspect of our mental health challenge has been that it's been dominated by anxiety, which isn't really surprising. I mean, the COVID is a threat. It's mysterious. We don't know when it's going to go away.
Professor Jordan says most cases of anxiety are not dangerous and can be managed, but he worries about when anxiety gives way to depression.
When we start to think of seasonal affective disorder and we start to think of the second wave and sort of going back to where we were before, we're getting a feeling of helplessness and disempowerment, that we don't feel like we have any control.
Back in April, during the first wave of the pandemic in Ontario, an Angus Reid poll found that more than 40% of Canadians were feeling anxious or worried. Steve Lurie with the Canadian Mental Health Association expects that those numbers will go up slightly, but says there will be groups of people who are likely to feel the mental health burden a little more.
We know that there's a disproportionate effect if you happen to be in precarious work, if you're low income. The people who are living in the towers in the Jane Finch community, while there have been some innovative approaches to using the elevators, you're going to get anxious every time you leave your apartment because you have to take an elevator down. That's different from somebody who's living in a single family neighborhood and could put on their mask and walk out the door.
A spokesperson for CAMH acknowledged that there may be an increase in those seeking mental health services, writing in a statement, as measures on physical distancing increase or if lockdowns are instituted once again, we may see increasing numbers of people accessing services due to increased social isolation, which has been associated with numerous mental health problems, including depression, anxiety, and substance abuse.
We know this virus has had a profound impact as people have had to isolate and put off visits with family and friends. For our kids and young people, it's been especially difficult.
Today, Premier Doug Ford announced a $24.3 million investment in mental health services for children and youth. The money will go towards hiring more staff, improving access to services, and creating new programs to manage stress, depression, and anxiety. Professor Jordan says it's important to recognize the signs and symptoms of mental health illness. He does have a free course online that teaches you how to identify and manage anxiety during COVID-19. As well, the Toronto branch of the Canadian Mental Health Association has plenty of resources, including a list of virtual healthcare services. You can find links to both of those on our website, citynews.ca/extras. For City News, I'm Natividad.